Order. I have received a letter from the honourable member for McCullough proposing that a definite matter of public importance be submitted to the House for discussion, namely the government's failure to recognise the achievements of older Australians. I call upon those members who approve of the proposed discussion to rise in their places. The member for McCullough.
No.
The member for McCullough.
Thank you very much, Mr. Speaker. In the words contained in my letter to you, Mr. Speaker, they contain a sober reflection of what is really a more serious problem, and that is the way in which the government is treating the achievements of senior Australians. It's the sneer in the voice, it's the pejorative language, it's the implication that all the problems that this government might face now in making projections for whether it's going to raise taxes, such as bringing in the ETS, grand tax on everything, or other taxes, it's all the fault of senior Australians who are daring to live longer and healthier lives. That indeed is a cause for great joy, not a cause for insulting and demeaning those senior Australians who have built this country, raised families, and given us the great prosperity that we enjoy. With the production of the last Intergenerational Report, we had from Mr. Swan dire predictions about what a problem we were going to have to face, and that senior Australians were definitely a problem that had to be dealt with, whereas in fact there was nothing new in the statements that the Intergenerational Report has made. The earliest publications on the fact that we are an ageing population were made as far back as 2001, when the first amount of serious research by Access Economics was done, showing, quite frankly, that the way we have organised ourselves in Australia, with an age pension being paid out of consolidated revenue, not out of funds which were in fact in overseas countries going to go broke because they had not figured on people living as long, that the arrangements we had put in place made it quite sustainable and able for us to deal with. Now, one of the areas where we do have a serious funding problem is our healthcare system. But the healthcare system is not the problem of the ageing of the population. It plays a very small part in the overall escalation of healthcare costs. And to try and blame it on the senior Australians and try and make people feel badly that they are using the healthcare system which we have built up is in fact reprehensible. If I can say statistically, we all use the healthcare system the most in the last 2 years of our life. I have never been prepared to say which are the last 2 years of my life, and I have never asked anybody else to do that either, because it is simply silly to do so. But what is real is if we properly use our healthcare system properly, use our pharmaceutical benefits system properly, use our private health insurance properly, and take care of our public hospital systems properly, then we will see something that we should all strive towards, and that is the compression of morbidity. That is the time that people are unwell or infirm or have some form of incapacity is compressed into a smaller and smaller time of life, closer to the time of death. Now, relevant to this whole question is the way in which the government is presently attacking the private health insurance system. Currently, we have over 9 million people who have private health insurance. And it is a very sensible policy because it opens up an alternative to the overburdened public hospital system. We have an efficient private hospital system, and it is the private health insurance organisations which indeed finance it and enable it to be in place at all. There was a time previously when Senator Richardson, indeed the infamous Senator Richardson, I guess, spent most of his time trying to drive private health insurance down below 22%, which would in fact mean that the whole system would collapse. Fortunately, we on this side, even in opposition in those days, always maintain a strong and purposeful campaign to maintain a good private health insurance system. Finally, we prevailed. And when we brought in our reforms, when we were in office, what we have seen is now a very high incidence of private health insurance. And it's been a carrot and a stick. There is a levy and a surcharge if you are earning above, I think it's $75,000 a year, and you don't have private health insurance, you have to pay an additional 1% levy. That's fair. But we also said we would give a rebate if you took out private health insurance. We set it at 30% initially because 30% is about the rate that of income tax that 80% of the population pay. And so it's a good benchmark. We then said Medicare is available to everybody. Therefore, the private health insurance rebate should be available to everybody who takes it out. The stipulation is you can only have the rebate for private health insurance if you are eligible for Medicare. So the two are inextricably linked, and it is fair and reasonable that we continue to see and support a private health insurance system. If you look at older Australians, you will see that they value that private health insurance almost more than anything else. And indeed, the older our senior Australians become, the more precious it is to them, because they know that the way that Labor governments right across Australia have let our public hospital systems run down, that their opportunity to have other than life-threatening incidents dealt with immediately in the public health system are so low that they feel they need that backup to know that they can have doctor of choice and entry to a private health facility with that private health insurance. Now, this government is set out to penalise people. It is set out to take away that 30% rebate for thousands upon thousands of Australians. And yet in the lead up to the election, on this side of the House, when Mr Rudd sat here and when the Minister for Health sat here, they would stand up day after day and say they would not touch the private health insurance rebate. No, hand on heart, we wouldn't touch it. You can rely on it remaining with us. And indeed, they did write a letter. They gave every assurity to the Australian people that they would be a safe pair of hands if they were elected. Well, how they've let the Australian people down. The litany of broken promises that have come, that we now see, where they have promised that they would not tamper with things that affect particularly senior Australians, and yet they have. Look at superannuation. Look at superannuation. Ripped out of the system the benefits that we as a government put into it to allow people certainty. Do you know, two of the favourite words that the government likes to use is certainty and complexity. They have certainty when they say, if we get our policy in, it'll be certain for this group or that group. But when they can't answer the questions as to why it's unfair or why it won't work or why people can't comprehend it, it's complexity. They're their two favourite words. They are code words for saying we're breaking a promise and we really don't know how it's going to work.